The antibiotic resistance crisis and what it means for food systems. Antimicrobial resistance, AMR, is an urgent global threat which resulted in the deaths of 5 million people globally in 2019, according to the US CDC. By comparison, COVID-19 has killed 6.9 million people in the 3 years since the pandemic began. Antimicrobial resistance, therefore, is more deadly than the global COVID pandemic, and it's not going away. It's predicted to cause 10 million deaths per year by 2050 if we don't solve this problem. Antimicrobial resistance was recently designated one of the top 10 public health threats facing humanity by the World Health Organization. Antimicrobial resistant microorganisms are difficult to control using traditional technologies like antibiotic drugs and disinfecting chemicals. When they cause infections in humans, the infections are harder to treat and more likely to be deadly. Antimicrobial resistant organisms also wreak havoc on food production systems by causing difficult to control crop diseases or animal diseases. For example, rice leaf blast, a fungal disease caused by Pyracularia or rhizae, have seen the emergence of new variants resistant to fungicides, which threatens rice crops in affected areas. In shrimp aquaculture, antimicrobial resistance is posing challenges to production as aquaculture farmers try to prevent diseases from bacterial pathogens which have caused mass mortalities of farmed shrimp across multiple regions. Foodborne pathogens that carry antimicrobial resistant genes pose a greater risk to human safety than pathogens without the genes. For example, vulnerable patients who are infected with listeria after eating contaminated food are more likely to die if the antibiotics prescribed to treat them do not work. A recent survey of Listeria monocytogenes variants isolated from various ready-to-eat foods found that more than half were resistant to major antibiotics like amoxicillin, penicillin, and erythromycin. Antimicrobial-resistant E. coli was recently found in a significant proportion of raw meats from retail outlets in Spain, with multi-drug-resistant E. coli variants isolated from 40 of 100 samples of chicken, turkey, beef, and pork. An Australian survey similarly found that at least 55% of bacteria isolated from raw beef and 39% of bacteria isolated from raw salmon purchased from supermarkets were resistant to at least one medically important antibiotic. The prevalence of antimicrobial-resistant pathogens in food appears to be increasing. For example, the US Food Safety and Inspection Service reported earlier this year that variants of Salmonella isolated from chicken carcasses and chicken product samples between 2016 and 2019 were significantly more likely to be resistant to critically important antimicrobial drugs than in the period of 2014 to 15. Foodborne illness outbreaks attributed to antimicrobial-resistant organisms are also thought to be increasing. Last year in China, 23 people contracted typhoid fever after drinking water contaminated with extensively drug-resistant Salmonella typhi. In the USA, the proportion of Shigella infections, and Shigella is a foodborne pathogen, caused by extensively drug-resistant Shigella increased from 0% in 2015 to 5% of infections in 2022. The rise of antimicrobial-resistant pathogens in hospitals and other clinical settings is attributed to the overuse of antimicrobial medicines, including antibiotics and antifungals, in the treatment of human illnesses. In the food chain, antimicrobials used in intensively farmed food animals like pigs and chickens to prevent infections and to promote growth can create large reservoirs of AMR bacteria, which can then spread to humans directly or through the food chain. What can you do about AMR? Food professionals can assist with efforts to curb the problems from antimicrobial resistance by sourcing raw materials from primary producers who limit their use of antibiotics in livestock, being aware of fraudulent practices with veterinary certificates and fraudulent claims about antibiotic use in animal food production, following good personal hygiene practices when interacting with farm animals and food crops, ensuring that food facilities maintain the highest sanitation standards to prevent reservoirs of potentially resistant pathogens like Listeria from forming in hard-to-reach places. continuing to follow risk-based food safety procedures in food manufacturing and catering operations to eliminate pathogens in food so resistant pathogens cannot infect consumers, and continuing to educate consumers about risky food handling practices such as washing poultry carcasses at home, cross-contamination from raw foods, and temperature abuse. Next up, we're going to talk chemicals.